What is the most appropriate next step in management? A 68-year-old man presents with right upper quadrant pain. There's fever, there's a history of recent fatty meal intake. On examination, he has a positive Murphy sign. His laboratory results show leukocytosis with band forms, elevated bilirubin and alkaline phosphatase. What is the most appropriate next step in management? A, immediate cholecystectomy. B, broad spectrum antibiotics. C, ERCP to remove bile duct stones. And D, observation and pain management. And the correct answer is broad spectrum antibiotics. So that is B, broad spectrum antibiotics and supportive care. Right upper quadrant pain, fever, recent fatty meal intake, positive Murphy sign, laboratory shows leukocytes with band forms, elevated bilirubin and ALP. So this patient shows signs of acute cholecystitis complicated by sepsis, right? This patient is obviously septic because of the band forms and the way the patient is presenting. So there is some systemic inflammatory response and elevated bilirubin levels and alkaline phosphatase. So the initial management should focus on stabilizing this patient with broad spectrum antibiotics and giving supportive care. In most of the cases, you want to give some fluids as well, right? It is when you've stabilized the patient that you can do further interventions like ERCP or cholecystectomy. But in the immediate case, when the patient is that sick, the patient has fever, you don't want to just go and open that patient up. You can, disseminate the whole septic focus. So you want to be very careful in the way you are handling this particular patient. Broad spectrum antibiotics and supportive care.